combining vowels followed by the suffixes. So we have those terminologies to be looked as a combination of these three parts. So in my all these terminologies, if made in pieces and is separated, that helps us to understand it in a more tangible and comprehensible manner. For example, when we break it down in the word parts, we have a beginning that's called prefix, and usually these prefixes, they are description of what the number. It could be how many, like mono, di, tri, hexa, penta. It could be amount, like poly or olig. It can be size, like micro, macro. It can be location, where is gastroenteritis and where it is located, and also is associated with colors, because we need to know the colors of those. It could be cell erythrocytes, or then we have the middle part that's called root. Most of these middle pass roots are actually vowels, and O remains the most dominant vowel that relates to a part of the body. And then we have got endings called suffixes. Usually suffixes tell us about a condition. It could be related to a process, a procedure. It could be surgical. It could be ectomy, removal. It could also tell us about the amount of, or probably location. Now, some of the common prefixes will be dealt here. Like O means without, not having it, like apnea, that's a loss of breath. Achlorohydria, this hydrochloride is missing. Atony, that means the bone has lost its density or its strength, the robustness, and also means without. So anaerobic is the process of cell division, cell replenishment, or anemia if is having something to do with the loss of blood or inadequacy or shortage of blood. Anesthesia. Aesthesia is sort of feelings of the human body that we have the tinge of feeling. If it's anesthesia, that means during operational procedure, the patient is administered this dose of anesthesia to make a certain part of the organ numb or unfeeling. Against, oppose, like antibiotic, those are medicines which work as, they work against the viruses or against the harmful germs, and some kind of anti-peristalsis, anti-inflammatory. Most of the antibiotics are actually anti-inflammatory. So we have laparo, some to do with abdomen. Not the stomach, the whole of the stomach. Stomach is that includes the whole part of under the chest, rib cage until the pelvic muscle. So laparotomy. Then we have laparoscopy, scopy like endoscopy, getting to have investigation, examination of the inside of the body organ. Litho, it's stands for stone, so lithotripsy, urolithiasis, cholelithiasis, and lithotomy. Lipo is fat, could be liposuction. The obese people, they go for this liposuction. Removal of additional undesirable fat elements inside the abdominal area. So lipemic, dyslipidemia, lipoma. Mal abnormal, it's a condition which is not desirable, and it refers to the malfunction, improper functions, malabsorption, or I mean, the digestive system could have malabsorption, malnutrition. That means not having enough of the basic nutrients that our body needs in the form of the calories. It could be malunion. Mast stands for breast. Mastectomy is a removal of the breast, mastitis, and there's inflammation or some kind of undesirable growth. Or then we have mastalgia, gynecomastia. Gyneco is something to do with the women's disease, and if it's mass, that means something related to the breast. Myo relates to muscles, so myocardium, myocarditis. Itis is something kind of painful inflammation, or myopathy. Patho is the signs of diseases like allopathy, homeopathy, naturopathy. Myoma, myosarcoma. We have rhabdomyolysis. Oma is a kind of lump or a growth, is a kind of mass, this kind of blown up tissue, a kind of tumor. Tumor can be benign and malign. If it is benign, it's not harmful for the body, and that's just an unwanted growth. It can be removed, but if it is malign, that means it could be carcinogenic and cancerous. So it's hematoma. So it's a lump and mass inside the blood. Hemo is something to do with the blood. Adenoma, hepatoma, something to the liver disease. Lipoma, something to do with the fat. Sarcoma. Then we have carcinoma. Carcinogenic items like it's too cancerous, and it's consumptions of some of the carcinogenic, like cigarette smoking and those kind of rhabdomyosarcoma. Then we have adenocarcinoma. Ostomy is an artificial opening as kind of laceration or puncturing of the tissue. Tracheostomy, cystostomy, and colostomy. Elastomy. Otomy is like incision. It's an operational procedure, and it could be laser guided. These days we have laser guided, which is really painless, and it seals all the cells while lacerating the body organ. So laparotomy, craniotomy, thoracotomy. Neph stands for kidney, and one who is specialized in kidney diseases is known as nephrologist. So whenever we have any issue with kidney, it could be kidney stones, nephrotic syndrome, there's some sort of ailment, and it's not functioning, and it's not releasing the waste material from the body, and it leads to the accumulation of those like excreta. Or so nephritis is inflammation of the inside of the kidney, pyelonephritis, nephrotoxic, and toxin accumulation inside the kidney. Hydronephrosis. Now, olic is have something to do with number. It's few, like oliguria. I mean, like there isn't enough of urea. I mean, uric acid or urea. Oligospermia, the count of sperm in men. Oligohydramnios, and peri is about all around, and pericarditis. So it talks about the location where it is. Actually, it's around or inside, or so perinatal. Something to do with the newborn babies. It could be pre or postnatal, perioperative. I mean, it's before the operation, or the area of the operational zone. Prostrate gland. Prostatitis, that means there's inflammation, there's abnormality in the prostrate gland. That gland, works in the release of the urea, I mean urine, and if it doesn't work right, it's urethra problem. That means there will be frequency of urination. It will lead to the dripping and the weak stream in the urine passages, and prostatectomy. That means there can be a situation where some of the glands have to be removed and fixed, or it could be over secretion, under secretion of the amino acids that they release to normalize the anabolism or catabolism of the body. Pyro is fire, pyrexia, apyrexia, antipyretic, pyrogen. Tachy, or opposite will be brady, fast, tachy. So tachycardia, that means your heart rate is more than 60. That's just normal range. And so if you are trying to scale the ladders, or trying to use the staircases, you find your heart pumping faster than usual. But that could be is a temporary situation. If your heart goes faster because of hypertension, the blood sugar level and all that, tachypnea is a loss of breath, and you are when it's heaving a sigh of relief, but you're not getting it. That means your heart is faster than the normal rate, is pumping faster than the normal rate, and the body flow to the arteries and veins not reaching. Paresis, motor weakness. That means you have motor neurons of the body. That gives you kinesthetic and motorcycles. Hemiparesis, paraparesis, monoparesis. Phagia, eating, and dysphagia, is the eating disorder. Aphasia and phagocytosis. Phagocytosis. We have phagia and we have phagia. So if it is phagia, this is called a speech problem, like dysphagia. Expressive dysphagia, receptive dysphagia. You have a problem uttering or expression certain sounds from your vocal cords and all that. You have speech impediments, and aphasia, it could be total lack of speech utterances, expressions utterances. It could be faulty, dysfunctional. This arthria has something to do with the bone, actually. So when we are talking of more prefixes, the locations and the movement, we come to these of the prefixes, like epi, peri, or circum. They all mean the same. It's all around. Endo, intra. This could be inside or inner or interior. Like endoscopy, that means there is an investigation inside your abdomen. Exo, extra, it's outside, outer, exterior. You can see the opposites, endo and exo. Exo is outside, endo is inside. Inter is different from inside. Inter is between, like intercellular, intermuscular. It's like intercontinental hotel. It's across the countries. And trans, the other side, and across. Transfat, transplant, if we remove certain organs of the body and try to fix it and plant it in another person, so that would be transplant. This is very common with hair transplant. People go for it. Actually, it's your hair from the thigh part, or where there is good growth of the hair, and that's grafted. It's removed and grafted on your head, and it's allowed to grow, because it's, say, your DNA under the root of a hair, trans across, dia, per, through, or complete. That means it's 100%. It's like it's not thoroughly, it's actually through, complete. Medial, it's middle. Para is nearby. Juxta, next to, beside, adjacent. What juxtapose means, it's placed next to each other. Ab, so this prefixes movements could be ab, away from, add, toward, and this to separate, like displacement, disjointed, this kinds of. So basically, common prefixes and anti and ante, they all talk about without, like without apnea and all that. So we already mentioned these kind of. What about plegia? Plegia is paralysis. That means inaction or passivity of a body organ, and it happens because of stroke. The stroke is because of the, either the overflow of the blood to the veins, arteries, and hemiplegia, paraplegia, monoplegia, quad. And you can see the numbers here, like mono, single, quad, four, tetra, tri, palsy, Palsy is like paralysis. It's a short term use for paralysis. Pnea, actually it's pnea, and the spelling is quite odd, because some of the spellings in this medical term are really strange, because like when we say pneumonia, it starts with P actually. So it's something to do with pnea is air or breathing. So dyspnea, apnea, lack of, or too much of, or tachypnea and bradypnea. So tachy is really fast. Brady is slow. So bradypnea, I mean slow breathing. Tachypnea is fast breathing. Orthopnea is something to do with your bones, and apnea. Now coming to some of the colors, prefixes like chromometer, they stand for actually color. So when we talk of some white blood cells, WBC, it's leuco. When we talk of red blood cells, erythrocytes. When we have cyano, it's blue, chloro is green, melon is black, and flav is yellow. It's rarely found this color, but they all stand for the colors. Brady, slow, bradycardia, bradykinesia, cardia, something to do with heart. So if it's a cardiac arrest, means that means a heavy stroke, and the patient is likely to die if there is no immediate resuscitation or chest to chest, mouth to mouth respiration, or I mean, it's not brought back to the heart is not pumped, or is sometimes we use electric shocks to bring the patient back to life. Cardiomegaly, something to do with mega and megaly. So this is an anomaly or some kind of disease or some kind of inflammations. So if there is a problem with the heart, it's cardiomegaly. Cardiology is the study of the science of logy. Whenever we talk of logy, that means that's the scientific study of something. So cardiology is the study of heart. And if somebody is studying the, obviously will be called cardiologist. Bile, cholecystectomy, bile. That's the deposition of the wrong, unwanted and desirable bile in the. So cholangitis, it could be cholecystitis, it can be melancholy. Actually, the word melancholy comes from chol. That means in the olden times, the Greeks and the philosophers, they used to believe that our moods and all are affected by these biles deposited in our body and or organs and glands. So if someone is most of the time under the weather, depressive, and he is stressed out and he can't be happy and all, so it's called melancholic character. So melancholy has to do with the deposition or accumulation of the bile. Colon, colostomy, colectomy, colitis, coliforms. So it's something to do with colon that deposits in the abdominal area. Cyst is a bladder. It can be benign, malign, cystitis, ovarian. Because among women we have ovarian cyst, and sometimes ovarian have to be removed. Ectomy. we have to go for cystectomy. And how do we know that these are cyst formation and the ovarian cesarean? Ovaries have to be removed. So we use cystoscopy. That's a machine. Like endoscopy, is going to look into the investigate into that. So some more suffixes coming to them. Anemia is loss of blood. I've talked about this anemic, insufficient amount of blood or deficiency, or polycythemia, leukemia. Leukemia is a kind of blood cancer actually. In the blood itself, we have the number of WBC and RBC, and we have sickles, cinerea. That there are certain diseases which are related to cell inside our blood. So it's cytology. And myoglobinemia. So it's hemoglobin is the major component of the blood, and myoglobinemia is loss of, not enough of having that kind of blood. And We need a certain percent of hemoglobin for the energizing of the all the basic organs of the body. ACE is action, process result of stasis, cholestasis, amyobasis, atelectasis, bronchiectasis. I mean, this is a process of result of. I mean, if you continue to be negligent about certain things, and your organs are likely to develop this kind of ACEs. That's a state of abnormality, improper functioning, or ectomy is surgical removal. It could be removal of any way, but it's a removal from body. So appendicectomy is like removal of appendices. So colectomy, polypectomy, and nephrectomy. Nephrectomy, I've seen the nephro is something to do with the kidney. Emesis is like regurgitating of something, like it's a reverse order of the food material and all coming back through your mouth and it's vomiting. Emetic, antiemetic, hematemesis. I mean, sometimes we need to go for force kind of emesis. Why? Because we have in certain kind of poisonous intake or over drugging. We need to clean up the bowel and abdominal area, and the emesis, some of the drugs are used to. Inflammation of conjunctivitis, itis is inflammation. It's like conjunctivitis, it's a disease, epididymitis, tonsillitis. Tonsillitis we have under the jawbone. We have two of them, and sometimes they have to be removed, and they get inflamed. When they get inflamed, you have all kinds of cold, cough, and you can't go for ice cream and kind of curd eating. And gastritis, of course, inside the abdominal and gastroenteritis, we have this disease of the with the digestive system. Roya is a flow. It's a smooth flow of. So diarrhea, that means there is no stopping of. There's no cessation of. There's no rhinorrhea, amenorrhea, and dysmenorrhea. I mean, this means malfunctioning. Estetoria and galactoria. Scopy, to look. Endoscopy is a way of. I mean, it's a very advanced medical surgical tool that allows miniature cameras to go into your inside body parts, including your veins. And if you have a neurosurgeon operating on your clotting, blood clotting in your nerves and all. Endoscopy is a brilliant way of looking at it. I mean, everything is reflected on the screen, and any doctor can pinpoint what exactly the problem lies. And the removal with that kind of precision has been possible only because of endoscopy. Colonoscopy, hysteroscopy. It's all kind of medical examination, or so gastroscopy inside our abdomen. The problem, what lies in maybe large intestine, small intestine. Tension, that's that actually is a synonymous word for pressure. So when we have hypertension, hypo, they're all both opposites. Hypo is lesser, hyper is more. So if you have hypertension, that means seems like you are not in control of your moods and feelings and all, and the blood flow is not regulated properly towards the brain areas, and your heart is either, I mean, there could be a blockage, it could be angioplasty, there could be a problem with the inflow of the good blood, that we have bad blood and good blood towards and away from. We have arteries and veins that work for it's a 4 chambers of the heart, where we have ventricles and auricles, and they keep pumping the blood towards every nook and corner of our body. And if the flow is restricted or impeded or some kind of inhibited because of the narrowing of the arteries, there will be hypertensions. And hypertensions. Now have a look at this, like a synopsis of all the medical terminologies. It's all about body organs general. Homeo is like body, cephalo heads, cervical neck. So cervical could be something to do with neck. Thoraco, chest, abdominal, pelvic muscles, lower, behind our stomach area, peritoneum, derm, something to do with skin. It could be epidermis, and so skin dermis. And the one who treats with diseases of the skin, it's called dermatologist, and the study is dermatology. Neuro is something to do with nerves. So neurosurgeons, they usually look at the whole gamut of the whole, complex, like a web of nerves that run through our brain. Hemo, blood, antero, angio, arteries. Like when we have artery blockage, we go for angioplasty. That means some part of the arteries are removed or blocked, and there is a bypass. That means the flow of the blood is regulated by altering or detouring, it's kind of detour, vena, venous. Vascular, something to do with vascular muscles, and muscular muscles, myosarco. So again, muscles, skeleton, bone. So the entire body is made of skeleton. It's called a skeleton, actually, bone. We have that. That's called the frame of the body. That's the anatomy. And when we talk about organs, they all stay inside the skeleton. Osteos, due to bone, cytocell, site cell, or cellular. Endo, inside. Some prefixes revisit endoscopy, endocardium, endocarditis, endometrium. Enteric is intestinal. Intestinal could be large or small. Esophagus, all kind of entry. So is a part of the digestive system that we have. Enteric could be fever, feeding, coated. So enterovirus, gastroenterologist. The job of the gastroenterologist to look into the abdominal part and look into the digestive system and finds out whether regulations of the amino acids from the glands and they are okay or not, whether it's over or it's under, or whether the kind of amino acids are needed are in the proper amount. This is dysfunction, abnormal or painful, like dysuria, dysmenorrhea, dyspnea, dysphagia, and dysphagia. Gastro, something to do with stomach, gastritis, gastroscopy, gastroparesis. Gly stands for sugar. So if our body cannot regulate the sugar that we consume through carbohydrates, we get the accumulation of the sugar in our blood, and that starts corroding the veins and arteries. And hypoglycemia, the hypo is always like lesser. Glycogen, so glycemia, that's the call hypoglycemic index. That means how much sugar your body contains in. And if that index is not within the range, that means either you are going for, you will have more of it or you will have less of it. That means it could be hypoglycemic or it could be hyperglycemic. Both ways you're going to suffer, because our body doesn't need more sugar than it can accumulate. It can assimilate or digest, or it can burn. Actually, it burns. That's the fuel of a body. Carbohydrate is the fuel of the body. It's like the petrol or the diesel or whatever you call it. So it burns and it gives the energy in the form of fructose, sucrose, and so many other sugar forms. Common prefixes: anemia, blood, anemia, loss of blood, polycythemia, leukemia, ACEs actions. And I've talked about this. Thermia. Let's go to thermia, heat. Hypothermia, hyper. By now you must have known that it's hypo and hyper is always about the amount of. So thermia is heat, and hypo less, hyper more, atheremia. Trophy is nourishment. Atrophy is without nourishment. That means your organs are failing. The organs are not in the proper state. And that's called ossification. Hypertrophy, dystrophy. Again, this is something not functioning properly. And urea and urine, hematuria, anuria, pyuria, dysuria, ketonuria, is all have to do with the urea and the blood, urine and volume urine, and hypovolemia and euvolemia. Some of the body organs medically known as, they are the nomenclature of some kind of specific term, like thyro stands for thyroid, trachea, esophagus, thymus, mammo, mammary glands, like breast, and the pneumo, lungs, and the cardio stands for heart. Now, embolism. Ism is like action or state of. Megaly is abnormal enlargement, like cardiomegaly. Sometimes the babies are born with larger heart than they are supposed to. And that means there is something not right, and it's not of the right size compared to the body, so splenomegaly, hepatomegaly, acromegaly. Ology, study of science of could be pathology and the study of the diseases. Cardiology, study of the heart diseases. Hepatome, liver diseases. Neural organs of the mind. Cytology, cells. Hematology, blood. So all of these talk about the study of sciences. Hepatoma, gastro stands for stomach. Hepato, liver. Cholecysto is gallbladder. Spleno, spleen. Pancreas, adrenal gland. Nephro, kidney. Antro, intestine. Colon, large intestine. So we have two intestines, and small and large. Large intestine, that is go to the anus part, and it releases all the feces and the waste material from the body. But it's like a whole system, digestive system, right? Start from ingestion to the release or excretion. So heme stands for blood, hematuria, hematemesis, hematitis, and hematology is the study of blood, hemangioma. Angio is like arteries and all. Hemi, half, like the world is divided into two hemispheres, like eastern, western hemisphere. Even our brain is divided into hemispheres, and like we say, left hemisphere and right hemisphere have the different kinds of skill developmental parts. And those guys who excel in logical, they have the left hemisphere and the right hemisphere, and those who have the literary flavor and they have a knack for, or they have, it's not a proven science, but there is a belief, and some science believe that our brain can be divided into two equal halves, two altogether different spheres. And hepato, something to do with liver. Hepatitis is a disease that affects our liver, and we have vaccines for hepatitis 1 and hepatitis 2, and hepatomegaly. Megaly is something abnormal enlargement, and if it is hepato is something liver. So sometimes our liver get enlarged, especially in case of jaundice disease, and it cannot digest, and our liver get damaged, digestion problem starts. Hepatocellular carcinoma. That's a cancerous disease, and hepato is something liver disease. Actually, it's a liver cancer. Hyper, high. Hypo, low. Towards an end of this, there is a quick quiz to check your general knowledge of some of the medical terms that I have just described, and I hope that my explanation and my parsing of these units and parts of the medical terminologies made it a bit easier to comprehend and make it more intelligible, in the sense that we know now how they are formed, the prefixes, the suffixes, and how the vowels, O, really works as a fine, combining or joining or linking the prefix and suffix, and gives you the total meaning of the word in unison. So whenever we have to, dissect the terminology midterm, we need to look at how it begins, how it ends, and how the beginning and ending, I mean, the front and then the back, they're joined together. So this is how we can really improve upon getting to know most of the medical prefixes. I mean, in this video, I'm only talking about the prefixes mostly. Probably in the next video, I might deliberate upon suffixes or some other uncommon, some kind of odd terminology. So there are some spellings which are really odd in medical terminologies. Why? Because they don't go by the conventions and the customs. And sometimes there are certain letters which are silent, some letters which are, said aloud, sometimes not aloud. I mean, unstressed and stressed kind of some letters, certain letters, simply because they are derived and borrowed from different sources. And as they occurred in the original language, they have been assimilated in English. And actually, we are not studying English, but we are studying basically those Greek and Latin, and sometimes some of the terminologies might come from the Arabic, also Arabic world. So that's all for today. Have a nice day. See you. Bye-bye.